My name is Jeff McQuay. I graduated from Nazareth College in 2017 with my master's in occupational therapy. When you're somebody who's had a stroke or a brain injury or severe arthritis, that's the occupational therapist's job in a rehab setting, to help people restore their ability to complete daily activities, including getting dressed, getting to the bathroom safely, cooking safely. So we're focused on exercise, we're focused on adaptive equipment, focusing on their mobility. Our role is to help people become independent with whatever their goals are. An occupational therapist could work in many settings. They could be working in a school, you can see them in group homes, an outpatient clinical setting, home care, in a hospital, or a nursing home. When you're helping somebody to restore their ability to participate in activities, when you have somebody they used to have to ask their wife, their husband, their daughter to help them put their clothes on, and then they don't have to anymore, it just gives them freedom. And seeing how happy that makes somebody, that's what makes the job very rewarding.